Welcome! In this video, we will discuss the new Clinical Reconciliation utility in NextGen 5.8. The Clinical Reconciliation utility provides a comparison between internal and external records for the same patient. It reduces manual entry of chart information by pulling in missing data as you approve each item. Together, these features promote the data sharing initiatives of Meaningful Use and fulfill its specific requirements of viewing, previewing, and confirming changes to the patient record. The Clinical Reconciliation utility is best accessed from the View menu in EHR. To open it, first select your patient, click View, and then select Clinical Reconciliation. When you open the utility, incoming patient records appear on the left panel of the window. Each record can be viewed and imported by using the tabs on the top right. The third tab here records a list of changes as you work. The tabs below this toolbar are used for importing specific types of information, such as medications, allergies, and more. The primary function of the Clinical Reconciliation utility is to import the outside data contained in the CCDA into your office's medical record. To do this, click the Import tab on the top right toolbar. If you are reconciling the chart with a patient or representative, choose the appropriate item in the Reviews menu on the right. While the reconciliation screen may look overwhelming at first, it follows a simple structure that is repeated for each aspect of the patient's chart. Right now, we're looking at the patient's medication list because Medications is the first tab in the second toolbar. However, if we click the next tab, we would review medication allergies, and then problems, and so on. Each tab functions similarly. On the left side of the Import tab, we see a table called EHR. This table displays the information we currently have in NextGen for this patient. On the right side of the Import tab, we see a table called Import. The Import table displays the information that was sent from another provider. These tables are placed side by side so that we can compare the contents and decide how we want the information to appear in our medical record. As we decide which information to add or ignore, the entries display in the bottom section. This serves as a preview of our selections. Finally, when we click Confirm, these entries will become our office's updated medical record for this patient. This process is repeated for each tab. To import patient data, first highlight the CCDA document. Then click the Import tab. Compare the details from the EHR table to the details from the Import table. Select the information to import, then review and confirm the result. Repeat this process with each tab as necessary. Let's take a closer look at how to compare and select the data that we wish to import. Because the intent is to pull information into our chart, we'll begin with the Import table. Items that match in both tables display with a link symbol in the Match column. Items that do not match require an action before importing. These actions include None, Ignore, Add, and Replace. Items can also be manually matched by clicking on the Match button at the bottom of the screen. Comments can also be added as needed by clicking the drop-down in the User Notes column beside the entry. User Notes display in the Reconciliation History tab. The EHR table will most likely remain the same throughout this process. However, we may need to make modifications as we go, and in many cases, it's easier to make the changes within the reconciliation screen than in other places in the chart. For example, if a patient has stopped taking a medication that is only in the EHR list, we can change the action in the EHR table from Keep to Stop. This will update the patient's medication module without the need to exit the reconciliation screen. Please note that deleting medications from this screen will also delete them from the patient's medication module. Follow your office guidelines concerning when to stop and when to delete medications in order to preserve medication history. The Reconciliation Summary section displays the result of our choices. The items that appear here are the items that will appear in our office's medical record. When it's correct, we'll click Confirm. When we do, the corresponding module in NextGen will reflect these changes. In this example, the medication module will be updated. This process is repeated for each module represented by the tabs here. The Diagnosis Codes and Procedures tabs contain one significant difference from the other tabs. Here, only the import data displays. However, if we wish to compare this information with the patient chart, we can choose the Replace action to review the information in our existing record, and then cancel if needed. On each tab, click Confirm. When we've reviewed all of the necessary tabs for a CCDA document, the process is complete. The Reconciliation History tab can be used to clarify the changes made during the reconciliation process. For example, if we need to double-check that a certain item was updated correctly, we can do so here by finding that particular entry. Comments entered into the Import table can also be reviewed here in the Reconciliation History tab. This concludes our video on the new Clinical Reconciliation utility in NextGen 5.8. Thank you for watching.